I'm Dan Riew, and I'm a spine surgeon from New York City.
What are you looking forward to at this conference?
I'm looking forward to a lot of different things at AO Spine. I'm looking forward to all the different speakers and reconnecting with all of my friends from all over the world.
Have you seen any innovative technologies?
I've seen a lot of different innovative technologies here. We talk a lot about artificial discs and the expanded indications for the artificial disc replacement. There are a number of papers that are discussing endoscopic surgery all over the spine, and I think that's an emerging technique that's going to gain some favor over time.
What do you think of the scientific program?
The scientific program is really outstanding. There are a lot of expert world leaders that have given many talks and are going to be giving talks on a variety of topics.
Why is it important to attend international meetings?
It's very important to come together at meetings that have speakers from all over the world, because then you get a really good exchange of ideas. People are very innovative, and that innovation isn't limited to just one country or one region. And so when you have an international meeting, you have people who bring their ideas from the Middle East, from Asia and Africa and North America and Europe and Asia. And so we have a chance to collaborate, teach each other, and to share interesting ideas and interesting techniques on how to treat spinal diseases.
What are the biggest challenges for spine surgeons?
Oh gosh, there's so many challenges that are facing spine surgeons in North America. We have challenges of third-party payers telling us what we can and cannot do with the spine. We have innovative techniques, but they have to go through a lot of hurdles getting approval from the Food and Drug Administration.
How do you see spine surgery evolving in the next 5 to 10 years?
Spine surgery is exploding and over the next 5 to 10 years, there's going to be some really exciting changes. Navigation is one of the fields that is really growing. AI is going to have a role in spine surgery. Robotics, imaging techniques, intraoperative CT, melding MRI and CT together to come up with ways of treating patients. New medications that are going to help osteoporosis, medications that's going to help the bone to heal better. I would say that you are starting out in a very exciting time in spine. There are so many techniques that are coming down the pike over the next 5 to 10 years, and educate yourself on all of those different kinds of techniques. Decide what you want to do. I personally have specialized in cervical spine surgery, and I think in the future, spine surgeons are going to be hyper-specialized. Sometime in the next 20 years, people are going to gravitate either doing a lot of tumors, pediatric, adult, deformity, degenerative, cervical, thoracolumbar, minimally invasive, robotics, arthroplasty. That's a hard thing, especially when you're starting out, because if you're in academics and you're trying to make a name for yourself, that means you not only have to have a practice, you have to teach, you have to write papers, you have to do research. And at the same time, you have a young family that wants to see you at home and wants you to spend free time with them. And I would tell you this, you have to keep things into perspective. No matter how famous you become as an academic spine surgeon, no matter how many laurels you collect, no matter how many presidencies of societies and how many honors you receive, at the end of the day, you're going to retire someday. And someday you're going to die. And on the day you die, the only people who are going to come to your funeral, they're your family. They're the people that matter the most. So you got to keep that into perspective and say that you want to make sure that you have a good marriage. You want to make sure that your children love you and that you are a good father or mother. And if you do that, you'll be successful in life. I have a number of different hobbies. I spend a lot of time with my wife. We go hiking a lot, and whenever we get an opportunity, we go somewhere.
What would you like to say to Dr. Sameh?
I would like to congratulate Sameh for putting on the most incredible conference. This is an incredible venue. The talks have been really stimulating and interesting. He's picked topics like the leadership section that you never hear at meetings. That has really nothing to do with academic spine. It has to do with things like work-life balance, about leadership, about how to run societies. And I found that very interesting, and the give and take with the panel was actually very good. The debates were really outstanding, and he picked great topics, and the speakers did a phenomenal job. And so I have to congratulate him on everything, every aspect of this conference.